Insulin. Insulin is secreted by the beta cell slit of Langerhans of pancreas. Half-life around 5 minute. Synthesis. It is synthesized in the rug endoplasmic reticulum B cell in the slit of Langerhans. Proinsulin, insulin. Metabolism. It is mainly degraded in the liver and kidney by a cellular enzyme called as insulin degraded enzyme. Action of insulin. It is mainly related with the regulation of carbohydrate mechanism and the blood glucose level in the body. Action of carbohydrate metabolism. Insulin is the only hormone in the body that reduces the blood glucose level. It reduces the blood glucose level by following action. Increase the transport and uptake of glucose by the cell. Insulin facilitates the transport of glucose from blood into the cell by increasing the permeability of cell membrane for the glucose. Insulin are also increase in number or glucose transport like GLUT4 promotes the storage of glucose. Insulin promotes the rapid conversion of glucose into the glycogen which is stored in the liver and muscle. Insulin activates the enzyme necessary for glycogenesis, inhibit glycogenolysis. The breakdown of glycogen into glucose in liver and muscle. Inhibits glucogenosis. Insulin prevents glucogenosis. Example, formation of glucose from protein by inhibit the release of amino acid from the muscle. Action of protein metabolism. Insulin facilitates the synthesis and storage of protein. It inhibits the cellular utilization of protein by preventing the conversion of protein into glucose. Therefore, insulin is responsible for the conversion and storage of protein in the body. Action on fat metabolism. Insulin stimulates the synthesis of fat and also increase the storage of fat into the form of adipose tissue. Action of growth. Along with the growth hormone, insulin promotes the growth of the body by the conversion action of the protein. Insulin leads to conversion of protein by increasing the utilization of glucose in the tissue. This is called protein sparing effect. Regulation of blood glucose in the level. In normal individual, blood glucose level is controlled within the narrow range. Normally, after overnight fasting, the blood glucose level in between 10 to 100 mg per dl. After 2 hours of meal, post-prandial, the blood glucose level rises up to 110 to 140 mg per dl. Blood glucose regulating metabolism is operated through the liver and muscle with the help of pancreatic secretion. Role of insulin. Insulin is the only hormone that reduces the blood glucose level. Therefore, it is known as anti-diabetogenic hormone. Role of liver. When the blood glucose level increases whenever the blood glucose level falls, the glycogen in the liver is converted into glucose and released into the blood. Role of glycogen. Glucogen increase the blood glucose level by the link to breakdown of glycogen. Role of other hormone. Several other hormones with the increasing blood glucose level are growth hormone, cholesterol, adrenaline, thyroxine. Level of insulin secretion. When the blood level is normal, 80 to 100 mg per dl, then the rule of insulin secretion is lower, 10 UUM minute. When the blood glucose level increases between 100 to 120 mg per dl, then the rate of insulin secretion rises rapidly around 10 UU minute. When the blood glucose level rises above 200 mg per dl, then the rate of secretion is called increase rapid up to 400 mg insulin. Biphasic effect of glucose. After a meal, when blood glucose level increase, then the release of DF insulin into the blood increase rapidly. When few minutes, insulin in the plasma varies from 10 U per mg to 100 U mg. It is because of the release of insulin which was stored in the pancreatic between the nails. Later, within the next 10 to 15 minutes, this insulin concentration reduces half, around the 40 to 50 um per dl. Now after next 50 to 20 minutes, the insulin secretion rise once again. They reach the maximum value around the next 2 to 5 hours. The prolonged increase in insulin release it is due to certain formation of new insulin molecule from the pancreas. Applied physiology, diabetes mellitus. Classification: Type 1 diabetes mellitus, insulin dependent diabetes mellitus. Type 2 diabetes mellitus, non-insulin dependent diabetes mellitus. Type 1 diabetes mellitus, it is caused due to deficiency or absence of insulin because of the destruction of beta cell in the slits of Langerhans. It is usually occur before 40 years age. Patients affected by this require insulin injection. Therefore, it is also known as insulin dependent diabetes mellitus. When it is developed during the childhood, it is called juvenile diabetes mellitus. Cause: degeneration of beta cell of slit of Langerhans, destruction of beta cell by viral infection, congenital disorder, beta cell or slit of Langerhans. Type 2 diabetes mellitus. It is caused due to the failure of insulin receptor to give response to insulin. Due to the body, it is unable to use the insulin. It is usually occur after the age of 40 years. About 90% of diabetes patients is type 2 diabetes mellitus. In most of it can be controlled by oral hypoglycemic drug, so it is called as non-insulin dependent diabetes mellitus. Cause: in this type of diabetes, usually the structure and function beta cell of slit of Langerhans and the blood level of insulin are normal, but the insulin receptor may be less absent or abnormal. It may be due to genetic disorder, obesity. Sign and symptom: glycosuria. It is loss of glucose in urine. It is usually occur when the blood glucose level rise above 180 mg per dl. Polyuria. Excess of urine formation will increase the frequency of avoiding the urine, which lead to polyuria. Polydipsia. Increase in water intake. It is called as polydipsia. Excess loss of water decrease the water content and increase the salt content in the body. This stimulates the thrust center in hypovolemia, which include increase the intake of water. Polyuria, जास्त जेवण करणं. Polyphagia means intake of excess of food, which very much common in diabetic mellitus. Complication: hypertension, myocardial infarction. Diabetic nephropathy, diabetic retinopathy, diabetic neuropathy. Diagnostic test: fasting blood glucose level, post-prandial blood glucose level, urine glucose examination, glucose tolerance test. Treatment: for type 1 diabetes mellitus, it is treated by exogenous insulin. It is generated given by subcutaneous injection. For type 2 diabetes mellitus, it is usually treated by oral hypoglycemic drugs.